All right, good afternoon, everyone. My name is Derek Anderson. I'm the Executive Director of Northern Westchester Hospital, Northwell Health. We're excited to be back with you again this afternoon, and I'm joined by my colleagues, Dr. Marla Koroly, who's the Chief Medical Officer, Senior Vice President, and also the Chief Physician of Westchester for Northwell. So Marla, welcome, Dr. Koroly. And also Dr. Lev Davidson, who's the Director and Head of our Cancer Program here at Northern Westchester Hospital. We're happy to be with you, and today, most importantly, we're talking about everything going on in our communities around COVID and some of the uptick in COVID cases that we've been seeing across the country, and even in New York, and even a little bit here at Northern. So as of this morning, the hospital had about 4 COVID positive patients. That is down from, you may recall, at the height of COVID, we were as high as 95 or 100 at any one given time in the hospital. So dramatic drop. But for several months, the hospital has stayed pretty static at 1 or 2 at most. And in the last few weeks, we've gone up as high as 9, and we're currently at 4 admitted patients. And so a little bit more on this in a moment with Dr. Koroly. We've seen, as we look across the Northwell health system and the region, there are counties within Brooklyn and Rockland and Orange counties that continue to see an uptick in cases. And as the weather becomes cooler, people are traveling and hosting and seeing people more indoors. There are just a couple of key messages that we want to reiterate and talk through. But before we do that, and before we jump into this topic, a couple of items. The first is, if you have questions, please post them in the Q&A. If you're joining us via Zoom, we're also checking Facebook Live. So if you have questions, you can post them on Facebook, and we'll try and field both questions. And please feel free to start questioning and sending in comments or questions. And as soon as we kind of get through a few important topics, we're going to jump right into questions and what's on your mind. So again, Derek Anderson from Northern Westchester Hospital. Thank you for those who have just joined. We're excited to be here. Hospital has been recovering really, really well in the last several months, post-COVID, post the height of COVID, I should say. And as we look at patients seeking medical care, one of the topics that Dr. Davidson is going to speak to us about for a few minutes is around not delaying important routine diagnostic and screening care. And so more in a moment on that. We're going to continue to encourage everyone to wear the mask. We know that it does prevent the spread of this disease. We saw a dramatic drop in spread when we first implemented a mask for our team here at Northern back in March. And that holds true for these many months. Social distancing, and especially now as we start to get into the colder weather and things move indoors, being very mindful of good hand hygiene, social distancing, and wearing a mask. So we're going to continue to reiterate those messages. We appreciate how responsive our community here in Northern Westchester and Putnam and Fairfield counties have been, and how good and diligent we've been about preventing the spread within our local community. But unfortunately, we are seeing a slight uptick, and I'll defer to Dr. Koroly on that. So with that being said, Marla?
Thank you, Derek. So hi, everybody. So as Derek mentioned, what we spoke about back in March when we did some of these webinars before, and April, same 3 things: wearing masks, social distancing, and hand hygiene. Those are still the most important things to keep yourself safe. And we have learned so much since the first time around. So we are very hopeful that we can continue to maintain operations and keep our surgical programs and other programs opened, at the same time maintaining your safety of our staff as well as patients as well as the community by using appropriate safety precautions. We have as much personal protective equipment as we need. We've never had a shortage of that. Our staff still continue to use it every day. So we're confident that we're keeping everybody safe. In addition, we're doing a lot of testing. So Northwell, we talked about last time, has a very reliable platform for COVID testing. So we're continuing to do that. We do that for every patient that is admitted to the hospital, regardless of why they're being admitted, just so that we know how to keep everyone safe. We do it within 3 days prior to any scheduled surgical or other procedure that people are having. Again, so we can understand what the situation is and we can keep everybody safe. I'm just going to share my screen for one moment. Hopefully people can see it. Okay. No, not seeing it. Okay.
Yep, we can see it, Marla.
I don't think that's, are you seeing the antibody testing slide?
Yes.
Okay. All right, so we are doing 2 different kinds of tests that we're doing for the community at our Center for Healthy Living in Chappaqua Crossing. So we do antibody tests for COVID-19 that tell us if you've been exposed, if a person's been exposed and has antibodies against the virus. And we're also doing the PCR test, which is the nasal pharyngeal swab. That is a way to diagnose current infection. So anybody can come to the Center for Healthy Living to have either of those tests done. No appointment is necessary, but you do need either an order or prescription from your physician. So you can contact your primary care or other treating physician. They can write your prescription for either of these tests, and you can go to Center for Healthy Living and have the test done. The other thing that we just went live with yesterday at the hospital is a respiratory viral panel. Is that slide showing right now?
Yes. Yep,
Okay.
we can see it.
I just can't see it. So this is important because as we go into the fall and winter season, we're going to see more and more influenza. Like every other year, we begin to see flu. And symptoms can be very similar between COVID-19 and influenza. So it's important that we can distinguish. So when people arrive either in our emergency room or anywhere at our hospital with symptoms, we have a respiratory viral panel that we do, which is also a nasal pharyngeal swab. So a swab inserted into your nasal cavity and then tested. And this new panel now, in addition to testing for all the other viruses that are listed there, influenza, adenovirus, et cetera, and a couple of bacteria, chlamydia and mycoplasma. In addition to all of those, which we've traditionally tested for, our new panel now includes also the test for the coronavirus that causes COVID-19. So we'll be able, with people with symptoms, we'll be able to distinguish what it is they have and know how to best care for them. So we're happy that we have that. It's really important to have the ability to test. And I just want to remind everybody, even though we've been so focused on COVID-19, it is important, especially important this year, for you to get a flu shot. An influenza vaccine is recommended for anybody over the age of 6 months, unless you have some kind of medical reason not to get it. And that way you're less likely to have the flu, less likely to develop symptoms that would be confusing us between the flu and COVID-19. So that's really the update on the testing. Again, important to get the flu shot, keep yourself safe. And now I'm going to turn things over to Dr. Davidson.
Thank you, Marla. Thank you, Derek. Thank you for allowing me to be here tonight. I think this is a very important topic. And thank you for participants for joining us. This is something that concerned me from early on in the start of the pandemic. The indirect toll that the virus would have on our healthcare system. When I would walk through the hospital, I would speak to the medical doctors, our emergency room doctors. We all agreed that we stopped seeing people coming in for the usual problems, such as chest pain, abdominal pain, either to the hospital or our offices. I knew that we didn't eradicate heart disease or gallbladder stones completely. So made you wonder what happened to all of those problems that we used to see regularly. And very understandably, people were very nervous to come to the offices and facilities for fear of this infection. In seeing this, I became concerned, are people going to stop receiving their cancer care? Are they going to stop screening and performing life-saving cancer screening for the same exact reasons? You know, it turned out that I wasn't the only one who was concerned for this. I would like to quote Dr. Sharpless, who is the director of the National Cancer Institute. Earlier this summer, in an editorial piece, he stated that estimations at that time, that's early in the summer, at that time, showed that decrease in screening that had happened up to that point for only colon and breast cancer, not any other diseases, but colon and breast cancer, at that time would already wind up costing approximately 10,000 lives. So how significant was the drop-off in screening? Derek, if you don't mind, could you show the graph?
Absolutely. Yep.
Thank you. So this graph, as you can see, breast cancer, colon cancer, and cervical cancer screenings. Obviously, the lines that basically completely drop off are for 2020 and around the time of the pandemic. As you can see, the other lines are for screening averages on a weekly basis in 2018 and 2019, which were very, very steady. And then you see this huge, huge drop off. Now, it's gotten better in the following months, but we are still far under the averages that we have seen year to year. So this is obviously, great concern. Screening has been clinically shown to save lives. Putting it off can lead to more advanced diseases at the time of diagnosis and possibly even losing the window in which to achieve a cure. So I wanted to present today to encourage people to resume their regular life-saving health practices. It's our responsibility to provide a safe environment in which to do this. And we've taken many, many steps as both Northern Westchester Hospital and as part of the greater system of Northwell. I am somewhat biased, but I will tell you, I personally feel safer coming to our facilities than going to the store. So why do I say that? Let me go over what we have done here to make it a safe environment. When people walk into the building, they're greeted by thermal cameras. So the body temperatures are being constantly checked to make sure that somebody's maybe not aware that they're symptomatic with this infection. People who come to the office are pre-screened by phone for infectious symptoms before ever coming into the building. People are COVID tested before receiving treatments in our facilities. Social distancing and masks are required. They're not a suggestion, they're an absolute requirement. We've reduced foot traffic to people that only need to be here. It's a very difficult time because obviously that makes friends and family a little bit difficult to get in here, but it's all for the safety of all our patients. We also time the visits in a way to minimize interactions of one person to the next. And the facilities are thoroughly cleaned on a very regular basis. So the right approach to cancer screening is unique to each person, and no one approach works for all. Each person can be at different risk for developing different types of cancers. So I urge everyone to assess this with their primary care providers. There's screening tests that can only be done in person, such as mammography, colonoscopy, pap smears, low-dose CAT scans for lung cancer screening, and blood tests obviously have to be performed in person, such as that for prostate cancer. However, there are options to do remote screening, such as checking stool for blood or checking stool for DNA suggestive malignancy, such as a test that's called the Colgar test. Other options may be telemedicine, telehealth visits, skin examinations oftentimes can be done with medical photography as well and reviewed by the practitioner. So the short answer to a difficult question, which is the most appropriate for each person, is again a discussion that should be had with your primary care providers. And we certainly encourage that this be done. And we try to return to our usual practices. Derek, thank you again for allowing me to be here tonight.
Yeah, Dr. Davidson, thank you so much. A lot of great information. Just for those who have joined us in the last few minutes, I'm Derek Anderson. I'm the Executive Director of Northern Westchester Hospital here in Mount Kisco. I'm joined by Dr. Koroly, our Chief Medical Officer for the hospital in the region, and Dr. Davidson, who's the Director of our Cancer Center here. And we're talking about this very important topic of not delaying routine and diagnostic testing, such as colonoscopies, mammography studies, through your primary care provider and specialists, so that it doesn't result in something more serious down the road or not being able to identify a disease. So there's a lot of questions on Zoom that we'll kind of start to work through. Please feel free to post questions in the Q&A on Zoom. Also, those who are joining us via Facebook Live, welcome, and please feel free to post in the comments section of Facebook, and we'll pick those up and try and answer as much as we can before we conclude. So on this topic, Marla, if we can kind of circle back, and Lev, feel free to jump in on this. We have an individual who is scheduled to come into the hospital for an endoscopy this coming Tuesday. And due to the increase in cases, am I safe to come in? Marla, do you want to talk and maybe reiterate some of the safety measures around specifically endo and what we're doing in the hospital?
Sure, yes, absolutely. So my answer would be yes, definitely. As Dr. Davidson mentioned, we have so much in place to keep every person that comes in here safe, including our staff, patients, and any family or visitors. So prior to your endoscopy that you would be scheduled for, you're going to go and have a COVID PCR test, a nasal pharyngeal swab, to make sure that you don't have COVID symptoms shedding the virus at the time, because you can even have that asymptomatically. So you'll have that within 3 days of your procedure that should have been scheduled for you. And we'll know that that result is negative before you go for your procedure. And we'll ask that you keep yourself relatively quarantined between the time you have the test and going for your procedure, so that you can't catch the virus sometime in between. There will be screening of any symptoms. Your temperature will be checked. And staff and all people around will be wearing personal protective equipment. So we do believe it's quite safe to have this procedure at this time.
Great, thank you, Marla. And Lev, anything you want to add on this front?
No, again, as I stated, there are so many, procedures in place to try to protect both the patients coming in and the environment as a whole.
Yeah, and maybe, thank you, Lev, if Dr. Davidson, if I could just add, since this pandemic began, Northern Westchester has successfully delivered thousands of babies, hundreds of babies, if not close to 1,000, and hundreds of surgical and other types of procedures safely. A lot of what the hospital is doing, we're doing is containing COVID, right? So COVID patients go into a separate isolation-based room with airflow that's appropriate for that, et cetera. And so we have very strict protocols, as Dr. Koroly and Dr. Davidson mentioned, around preventing as much as we can coming in the building. And then once you're here, COVID and non-COVID contained. I do want to mention, before we get to a few more questions, a number of individuals have asked about the field hospital. In front of Northern Westchester Hospital, you've seen a big white tent. It's hard to miss. And as you look at that, we've had it up for several months, and we plan to keep it up for another few months as we progress through the pandemic. And I want to just show you this briefly. You will notice that in the past couple of weeks, we've added some infrastructure to the field hospital. So what does that actually mean? You may be familiar with the photos on the right. We've done some things to even enhance what it feels like and what the patient care will be in the field hospital. But on the left, you see what looks like giant oxygen tanks. They are giant oxygen tanks, in fact. So this is part of hardening the facility. It's getting us better prepared. And we do not plan to use the field hospital, but if we should, we just want to make sure that we are fully ready for what may or what may not come. So you're going to notice that I don't want the community to be surprised. We are grateful to the village of Mount Kisco and the town for working so closely together with us on all of this work. But I just want to mention specifically the field hospital will remain up and on the ready should we start to see an increase in cases. So let's just go back to a couple of additional questions. There's an individual, Mark, who's asking, can a patient who tested positive and is no longer symptomatic, say it's been a month, can they still transmit COVID-19?
So It's a wonderful question. We all ask that question every day because there are a lot of people who, after being positive, continue to have a positive swab, nasal swab, and shed the virus for weeks or months. And no one really knows for sure what to make of that. Our best guess, and it is a guess because it's still new, relatively new, our best guess is that 14 days after you're done with your last symptom, and even if you're continuing to test positive, you're probably not contagious. However, having said that, we don't take any chances here, even if there's the tiniest chance. So if somebody here is in the hospital and is continuing to have a positive nasal swab, we will continue to keep them in that negative pressure room and treat them as if it's contagious. But medically, we believe it's probably not contagious after 14 days or even maybe 21 days, even more securely not contagious. But because this virus is new, nobody's done high quality studies to prove that.
Great. Thank you, Dr. Koroly. We appreciate you clarifying that. Mark, hopefully that was helpful. Both from Julie and Eileen on Facebook, Julie on Zoom is asking, how quickly does it take to get results from a PCR, a COVID PCR test? Marla, do you want to talk to that?
Yeah, it's a little bit variable. So if just a person is curious and wants to know if they're positive or is just coming in for a test for no particular specified time urgency, it could take 5 days even, because testing sites are so overcrowded. If we know that we have a specific time frame, in other words, you're having a procedure here scheduled and we need that result before your procedure, we're going to get that test within 24 hours result. So we kind of prioritize based on the urgent nature of how important it is to know that result. So we can get it as fast as 24 hours. There are a small number of rapid tests that we can get in 2 hours as well, if it's really an emergency that we know the answer right away. We tend not to use those tests as often because they're not as reliable as the regular test.
Excellent. Marla, on that topic, somebody did ask, has the accuracy of the antibody tests improved or is it still at 50%?
I think it's a little better. The antibody test, I think, is better than 50%. Certainly, I think it's a lot higher than that, but I'm thinking it's more in the 80s, the one that we use.
Okay, yeah, particularly the question specifically was antibody.
Antibody, yes.
Okay. Dr. Davidson, I'm going to ask if you don't mind answering this one. Michelle is asking, can you elaborate on indoor social distancing? It's been easy to take walks and socialize outside until now. Now that we have to move inside, can we even have anyone in our house? Question mark. What do you do with a weekly housekeeper or anyone who comes into your house? Do you mask up only? Thank you.
No, I generally try to practice everything that we, practice here in the office and facilities. So to try to avoid any exposure within 6 feet for any amount of time, especially if you don't know their COVID status, and obviously both parties, wearing masks. As far as within our facilities, social distancing can take many forms. As I mentioned, we try to spread out appointments so that people are actually not physically coming in contact with each other. We've moved our office furniture around to a point where no one will be either seated or standing or a waiting location that's within 6 feet of each other. And again, as I mentioned, it is an absolute requirement to wear masks within the office setting.
Yeah, great. I mean, and maybe just to add to that, this question is on a lot of people's minds as Thanksgiving and other holidays advance is what do I do? Do I host Thanksgiving? Do I not? And it sounds like the theme is be smart, practice social distancing, even indoors. And, a lot of good hand hygiene, masks help, all the things that we know can prevent the spread of this disease or really any disease like this should be followed. And I think that would be our recommendation. Especially now, I think everybody needs some social and mental connectivity with each other. And I think we just have to do it in a smart, vigilant way. Dr. Koroly, Dina is asking if the new cases that we've been seeing recently in the hospital, are they any particular age group?
It's pretty similar to the first round. People that we're seeing tend to be older than 65, or if they're not older than 65, they have risk factors such as high blood pressure, diabetes, or obesity, some with heart disease. But most of the people that we see have some kind of risk factor, just as the first time around.
And has the severity of the illness or the cases in the hospital, have they lessened over time?
So that's an interesting question. It's hard to say if the severity is lessened or if we've just gotten better at taking care of people and preventing them from needing ICU care. So I would say that the more recent group of patients that we've had, very, very few of them have needed to be in our critical care unit. The first time around here and the rest of the country, about 20% of patients that got admitted to the hospital had to go to the ICU to be on a ventilator for breathing or for other critical reasons. This time, just a couple actually have progressed to the point where they needed to go to the ICU in the last few months. We've had very few need that. So again, either the disease is less severe or we're better because we know more, not that we have a magic cure, nobody does, but we're just better at managing and knowing how to prevent them from needing that.
Excellent, thank you. If somebody's asking, if I have symptoms of COVID, do I still have to call my primary care physician, or does the hospital have anything changed? Does the hospital admit high-risk individuals earlier with difficulty breathing? So, I mean, I think maybe we'll simplify this one. Venkata, thank you for asking this question, which is, anytime you're having difficulty breathing, we'd recommend you seeking emergency medical care as soon as possible. We wouldn't delay. If you're having a hard time breathing, please come to the ER. Beyond a life-threatening disease, please contact and stay in frequent contact with your primary care physician. Even if, especially if you know that you're a high-risk individual or have any comorbidities, certainly our vulnerable populations, we're strongly encouraging stay connected to a primary care physician. If you don't have a primary care physician, I'm going to put up our contact information after this. Please let us know and we will get you connected to a primary care doctor. It is very important. And then really, again, just if you feel that you're having some sort of difficulty breathing or life-threatening emergency, call 911 or come to the ER. Okay. We're just about out of time. I think we're just going to take one quick question. From a public health perspective, would it be recommended to avoid spending any in-person holiday time this year with others who've had a positive COVID diagnosis in recent months, or are likely to have a greater incidence of exposure on an ongoing basis because of their job, especially when those other people are not part of my normal everyday quote unquote bubble? So Joanne, thank you for asking this question. And it's a good nuance to this question, particularly with the holidays coming up. Dr. Davidson, you know, you work with cancer patients every day. You see how high risk and vulnerable these patients are. What would you recommend for Joanne, especially if they're near someone or they have someone who may have been positive at one point in the past couple of months, or maybe in a job that's more high risk, like a frontline worker in any industry?
So as Dr. Koroly had mentioned, I think we've all seen the virus being shed for many, many weeks, if not months. I've seen folks here in our treatment center who continue to test positive. Do we really know what the infectivity is at that point? I also agree that we don't really know the exact detail. So for particularly our immunosuppressed, immunocompromised folks with comorbidities, I think it's just wiser to protect yourself, to take extra measures in those situations.
Yeah, great. And And Joanne makes a good point. We talk about this in the hospital with our staff taking meal breaks. One of the hardest times to keep a mask on is when you're eating, clearly. And so Joanne, really great point. And these are some of the things we struggle. There's probably no perfect answer, but to say, be smart. And if there's ways to even just distance, because right, there's a physical closeness to exposure it's part of the equation. If there are ways to distance yourself, lots of good hand hygiene. And then certainly we'd recommend if anybody is hosting someone who has any of those symptoms that we know could be related to COVID, and that might be a recommendation that they stay home and try and isolate until they figure out specifically what those symptoms are related to. So with that, we're going to end by just really thanking everybody for joining us. Please stay connected with us via social media. We are very optimistic that we won't see a trend or spike as we did as severely in the spring, but we are prepared as your community hospital if should something were to come. So please have that confidence and reassurance in us. And please do not hesitate to reach out. Contact us, call us. We're here for you should any questions come up. Otherwise, thank you for joining us today on this important talk. Thank you, Dr. Koroly and Dr. Davidson, for joining us as well. It's great to hear your perspective as always. And for our community, thank you for everything you're doing. Stay safe and be well.